Hello everyone. So I wanted to make a video to help you guys remember your medication administration skills for your practicum. So first we will be going over PEG administration. All right, so first what you want to do, you want to gather all your supplies. So what do you need? So you need your irrigation set, which will be your actual syringe, and it will be your little container right here to put your water in. So you want to go ahead and put some water in it, okay? All right, so then you want to get your pill splitter in case you have to give a half a pill. You want to get your pill crusher because it's going through the peg. So you're going to have to, crush the medications. You want to get your medicine cups. You want to get your gloves, and you want to have your hand sanitizer for hand hygiene. All right, so first what we're going to do is we're going to grab the medications that we need. So we're going to look at our MAR, and our MAR is going to tell us what medications are prescribed for that patient at that time. So what's prescribed for this patient now is lisinopril, 5 milligrams, and it has a note to say, hold if the systolic is less than 110. So I went to my Pyxis and I pulled this medication. So what we have available is a 10 milligram tab of lisinopril. So the order is for 5. So I know that I'm going to split that tab in half. Okay. So the other order it has is for your erythromycin. And that order is for 500 milligrams by the peg. And that's every 8 hours for an infection. So we want to make sure that we grab the correct dose. So in our Pyxis, we have 250 milligrams. So we know that we need 2 in order to give 500. So when I went to the MAR, I verified my medications while I was pulling the medications. Once I got the medications, I did my checks, and then now before I give the medication, I'm going to do my check. So we want to go into the patient's room. We want to introduce ourselves to the patient. Hi, I'm Asia. I'm going to be your nurse today. The doctor has ordered some morning medications for you. They're going to be going through your PEG tube, and I'm going to explain to you each medication. But if you have any questions, just let me know. So this is going to be our stomach right here. So this is going to be our PEG tube right here, and this is our stomach. All right, so we're going to go ahead and perform hand hygiene. And we're going to put on our gloves. All right. So the patient so far doesn't have any questions. So we would then scan our medications. So if we had a scanner, we would scan the patient's bracelet first, and then we will scan in each medication. All righty. So first, Miss Smith, you're going to be getting your lisinopril, and your lisinopril is for your blood pressure. So the doctor had an order in there to hold your blood pressure if your systolic blood pressure was less than 110, but your blood pressure is 136/72, so you're going to get it. So in real life, you don't have to read out that part like, oh, the doctor said this. You don't have to disclose that information because the patient probably looking at you like, girl, what? But, doing your practicum, it's important that you did know that the doctor had a hold order in if the patient didn't fit these parameters. But this is your blood pressure medicine. So what we're going to do is I'm going to scan the medication, and the medical record, it let me know, the MAR let me know that I'm supposed to give 5. So I'm going to open that medication, and I'm going to split it in half. So remember, your tabs have to be scored in order to score them. So if it doesn't have that line down the middle, you cannot be slicing the medication in half. So what we're going to do, make sure that your pill splitter is clean. And all you're going to do is line up the line. Slid out. All you're going to do is line it up. All right, so then press down. And it then split the medication in half. So the other half I would put in the trash, or I will put it in the sharps. All right, so this is one half right here. All right, so I'm going to go ahead and crush this medication. Now, what is our thinking when it comes to crushed medication? We can't crush extended release. We can't crush delayed release. We can't crush control release. We can't crush enteric coated type medications. So that medication was none of those. So we're good to crush. So we just put the medication in here and just turn. And as you can see, we got all the lumps out. We want just fine powder. So we're going to take our medicine cup and we're going to dump it in here. So you want to make sure that you get all the medication out of here, okay? All right, so the next medicine order we have, we would then have our erythromycin, and we're going to scan all both of these in the MAR. So we know that we need 500 mgs, so we got 250 mgs. All right, so as you can see, this is a capsule. So as long as it's not delayed release, extended release, or all those type of control release, we're fine to open a capsule unless pharmacy said that we can't open the capsule. But with this one, we're good to open a capsule. So remember, we're going to be giving all our medications separately, so we need a separate cup. So if you are working at a nursing home or something like that, they do have orders where you can crush all your medicines up and put it together, but you just want to check per facility. But what we teach you in nursing school is you're going to crush each medicine up separately and give them all separately. All right, so in order to open the capsule, all you do is twist it open. So you just twist. All right, there it's coming. All right. Uh-oh, we spilled some, but it is okay because majority of it went in there. So you want to make sure we empty the capsules out. All right. And then we'll do the next one. All right, we will open that one. It's so messy opening capsules and stuff. All right, we empty that side out. All right, so now we've got them both empty. All right, so now we're ready. Don't do that. I just can't look at that the whole time. All right, so now we're ready to dilute our medication. So we have some warm water right here, and the warm water will just help, you know, dissolve the medication. So you don't need a lot, just enough to dissolve it. All right, so if you're like me and you forgot to bring a spoon or something to mix your medication with it, you can always use your little piston syringe. And you just want to take it and stir. Stir, stir, stir. All right, so this one is a better example because this one really did a good job of being like fine, but this one has some little clumps in it. So these are not real medications, so sometimes they don't dissolve like a real medication would. So in real life, you want your medication to dissolve as much as you can, but with these demo medications, sometimes they just don't dissolve like that. All right, so we then go to our peg. So if our patient is hooked up to continuous feeds and stuff, we will pause it. So one of the things I like to teach you guys is always just to get in the habit of just checking your residuals, right? Because your hospital, different hospitals have different requirements. But I know that if a patient is getting continuous feeds and stuff like that, they want you to constantly be checking their residuals, maybe like every 4 hours or something. So we're going to use this time to check residuals as well. So we're going to just unplug that one, and we're going to go through this port right here. So in order to check their residuals, what we're going to do is hook our syringe up here and just pull back until we meet resistance. So I'm not meeting any resistance, so my patient doesn't have any residuals. So Another thing is, I always like to flush with force. So force means by the plunger. So how much do we have to flush with first before giving medications? 30 ml, so 30 cc's. So we're gonna pull up 30. So we can put our cap on this, and then we can set this down. And then we can actually come over here and actually pull up the 30. All right, so we got our 30 cc's. All right, so then we will come back to your peg, and then we will push it in there. And as you can see, it's going down, it's going down. All right, so after we flush with the 30 mLs of water, now we want to do everything else by gravity. So we want to take the plunger out, and then we want to just connect here. So this is by gravity. All right, so we're going to give our first medication because we've already flushed the line and it's good. And then we're just going to hold it up and wait till it goes down. So this is a longer peg tube, so it takes a while to go down. So we see we got some residuals right there. I'm just going to put a little bit of water in there to just get it from off the sides and just kind of shake it around, and then it's flowing, it's flowing, it's flowing. And that's just to get the rest of the medicines out there. All right, so we have one more medication to give. So how much mLs do we need to flush in between medications? 15. So what you can do is just look at the numbers on here, and you can see 15. And that's 15, and then we're going to hold it up. And that's going to flush that's to be the water flush. All right, so then let's give our last medication. All right, so we got some little residuals around here, residues. So what we're going to just do is do the same thing just to make sure the patient gets all their medicine. So lift it up. So that wasn't our flush, that was us just getting the regular, just getting the residue off the side. All right, so after we've got all the medicine in, we're now going to end with the 30 ml flush. So we're going to measure out 30. So remember, your numbers are right here on the side. And if you go over a little bit, that's okay. As long as your patient is not on fluid restriction, it's only water. All right, so you just administer medications. So after you finish, all you got to do is just disconnect here, and you want to make sure that you clean your plunger and your syringe off. You want to put the cap back on the peg tube, and you're good to go. If your patient was actually getting peg feeds and it's not contraindicated in the order, or it doesn't interact with the medications, you can actually start your peg feeds back up. And that is that.